Hey guys, this is the Nagging Doctor, and I'm here with my friend and patient. Sometimes I get confused, like were they friends first or patients, but really it's all the same.
It's all the same.
If you're a family practice doctor and you have been together for a long time, the relationship should be like that. And so we're starting off kind of a series and conversations with patients just so that y'all can kind of understand how did we get here, why did we get here, and learn from my patients, because I honestly learned from you from so many years. I don't even know how long I've been seeing you.
Ever since you were an intern.
Yeah.
With Dr. Fanny Clark.
Yeah.
Yeah.
So, as I said, when we were talking, she's like, well, why me? And I was like, well, you're one of the people who constantly challenged me to think outside the box and allow and integrate with, non-traditional medicine. But being able to be what we call CAMP, which is complementary alternative medicine.
Yes.
Yeah, so tell us a little bit about your journey. And you've come a long way. Like, she's lost all this weight. She's always been super healthy, but I would love to understand how you got into that kind of medicine and how you're able to do both. Like, that I think is the biggest challenge for people, is that they're either, I just do natural. I'm like, well, but your blood pressure is like 180.
Yeah.
But then if they do just meds, they don't do anything that requires them to be healthy.
Yeah. Well, my journey began, I'm a registered nurse and have been one since 1982. And in 1997, our oldest son was diagnosed with asthma. He had really bad asthma, like really bad. We came home that day, and I was really thinking about this on the way home. We came home and we came through the house, and I turned to my husband and I said, I can't do this to my son because this is a lifelong thing. Will you give me 3 months? Will you trust me? I'm gonna do some research. And that began my quest. And I realized a lot of what we were eating was processed food. I learned he had some milk allergies. I just learned all kinds of things. And threw it all away, started over again, and he's 35 and has never had another asthma incident since then. But I want to stress in my journey, which is why you have been integral for me and just my process, I do believe in traditional medicine. I mean, I'm a nurse, and I love nursing. I do believe in traditional medicine, but I always saw you as a complement to what I do. You could tell me what was wrong, you could advise me, and then I could go out and seek some wisdom in those areas. Just so you know, she used to give me a prescription and say, since you want to practice S&M, you can go home and do that. If it doesn't work, take this.
Everyone knows. All right, I'll acknowledge that.
And that's our relationship. She understands. But it was that process. And I think the biggest thing for me, especially coming out of just the whole nursing mindset, was, what kind of life did I want to live? What, I could live on medicine, I could live on blood pressure medicine, that's about all I took. Diabetes. I had diabetes when I was pregnant, gestational, and they kept telling me, when you get in your 60s, if you're overweight, there's a high likelihood that you will have diabetes. And I didn't want that, because last part of pregnancy, I was insulin 6 times a day. I just couldn't do it. I just knew I couldn't do that. So I look at life in terms of what's the best life I want to live. And just since October, I went to the fair with my son last October. That's our annual ritual. And he was talking to some of his colleagues, and I walked off. And he later said, why'd you walk off? And I said, I just felt so embarrassed about how I looked. And I thought, I don't want to live my life that way. So since October, I've lost 30 pounds.
Yay!
But it's all natural. It's all, I eat the right foods, and I think differently about food. Food is not my enjoyment. The people around the food with me are my enjoyment.
Right. So I love that. I couldn't have even paid her to go into, eating whole foods and eating naturally, because that is what we believe. And as y'all know, we have Dr. Spritzer, who is a lifestyle doctor. And what she does is actually help reverse disease whether it be diabetes, high cholesterol, hypertension, and lots of other diseases, require that your nutritional understanding is more advanced. And I think people think that they know how to eat healthy. They are very restrictive in their formats and how they get to whatever it is that they think is healthy. And so learning how to eat properly, and that is actually something that you can sustain. And then there's weight loss and even less pills, and then reversal of disease. All of that comes with a healthy lifestyle. And that's why here at the Mind and Body Center, we're really focused in on that's our foundation.
Yes.
And then as we move through this space, you're gonna learn more and more about kind of what we're gonna bring to y'all, and how it integrates with everyone at Southwest Family.
Yeah. And she doesn't even know this. This is true. I am no longer taking my amlodipine. My blood pressure every day is 110/68.
Yeah, after the 30 pounds.
After 30 pounds.
Well, congratulations, you know.
Which
So-
she told me.
Yeah, no, so that's a real testimony, you
Yeah.
know.
Yeah.
I'm proud of you, first of all. Congratulations. That is a testimony to what we are trying to do here. So let's come back for our next part of this little series as we try to introduce you to all the things that we have going on at the Mind and Body Center.